Thank you very much, Financial Secretary, the chairperson, for this morning's function. Let me first of all recognize my wife, Melissa, who is here with us, Honorable Dr. Kenneth Darrow, our Minister for Health and the Environment, my dear Cabinet colleagues, Your Excellency Steve Farrell, Secretary to the Cabinet, Mrs. Edwards, our Financial Secretary, Mr. Davis Slater, the Permanent Secretary in the Ministry of Health and the Environment, other permanent secretaries, Monsignor Eustace Thomas, who prayed for us this morning, Mrs. Janice Jean-Jacques Thomas, Director of the Dominica Social Security, members of the Board of Directors of the DSS, Dr. Peter Cowley, the PAO representative, Mr. Stanley Lalter, Health Economics Unit at the University of the West Indies, members of staff of the Ministry of Health and DSS, distinguished invited guests, the media, ladies and gentlemen, and all those listening and viewing the live broadcast of this very simple yet far-reaching, impactful program. While I had been asked by the organizers to deliver featured remarks, I am more inclined this morning to express my profound thanks and appreciation to the many public officers, private practitioners, the Pan American Health Organization, the University of the West Indies, and all others who have made the launch of this pilot project today a reality. Governments, as you know, have no shortage of ideas. But it is when all cylinders of a vehicle operate to maximum capacity and in unison that you get the optimum result. From the time this idea was adumbrated in the 2016 budget address, the Financial Secretary, officials in the Dominica Social Security, Ministry of Health, and other related agencies literally went to town on the mechanics of making it happen. And as a consequence, we are here today, less than 12 months later, declaring this significant milestone accomplished. I am particularly proud of this. I am happy for the impact this initiative will have on the targeted population. Sometimes we speak to issues, not understanding the life-saving effect they have on individuals. Ever since this concept was outlined, I have been inundated with calls and requests from single mothers across the island, inquiring of its commencement date and whether in fact it would be implemented during the period of vulnerability and need. Indeed, this initiative was born from a recognition of the day-to-day experiences of some in our midst who find themselves in circumstances not all of their doing or creation. Speaking from public platforms, in Parliament, and on radio stations is the glamorous and easy part of a politician's function. It would do some well, however, to sit for hours and listen as ordinary people speak to their realities in life and the challenges that beset them. Some people speak disparagingly of the public support program or the so-called Red Clinic. But I say to you this morning, there is nothing more numbing and energy draining than to hear the cries of people and not have the wherewithal to solve their problems in a timely fashion. That is one of the reasons I first floated the idea of this National Health Insurance pilot program to the Cabinet and ultimately included it in my budget address last year. We have as a nation to find ways of helping those in need and those who cannot always help themselves. It is in our direct consultations with the ordinary people of Dominica that this NHI pilot was born. Single parenting is not ideal or recommended, but it is a reality in Dominica and other parts of the region and the world. We can point fingers of blame from now until eternity. The reality is that as a caring society, we have to make provision for those who have genuine difficulties coping with the pressures of life. Parenting in an environment where there are no key support systems around is difficult at best and should not become punishing by a society that claims to be Christian-like in its orientation. That is why I believe we should all be particularly proud of this singular achievement this morning, because it says to all and sundry that Dominica is still the Dominica that we knew, that we love, and that we cherish. Not all beneficiaries of this program would have been contributors to its partial funding. But that is why we are fortunate in Dominica today to have the Citizenship by Investment program on which we can lean for support and sustenance from time to time. Because you will have seen in my budget address, I had indicated that a likely source of funds would have been the redundancy fund managed by the DSS. But because of rigmaroles here and there, I decided as Minister of Finance, I will not subject the ordinary working class people to this. And that's why we utilize the Citizenship by Investment funds to finance it. Because I always maintain, a man is still a man, even if he has one pants. Distinguished ladies and gentlemen, I am persuaded that as time unfolds, we will actually soften our anger and emotion towards the passage of Tropical Storm Erica. Many of you, I am sure, are wondering, now, how did the Prime Minister jump from the launch of NHI pilot program to Erica? For on the surface of it, the two are not connected. Actually, ladies and gentlemen, friends, they are connected at the hip. Just as infrastructurally, following the passage of Erica, we pledged to build back better, so too, from that day in 2015, the stakes were raised with respect to the quality of life that we must aspire to in this country. There is no point in building back better physical infrastructure if our social existence will not keep apace. I do not want to live in a country that has beautiful, well-lit roads, aesthetically pleasing and structurally sound bridges, a new hospital, a new airport, modern housing, affordable education from nursery to tertiary, but whose poor and vulnerable are not adequately taken care of. August 2015 must therefore be remembered as the point from which we set ourselves new yardsticks for measurement of development. When we spoke a few years ago back about taking Dominica to the next level, the launch of this pilot project today is the type of venture we were talking about. The soon-to-be opened and accessed West Bridge is a quality of craftsmanship we were talking about. The multi-purpose indoor sporting facility to be constructed at Stock Farm, with the inclusion of an Olympic swimming pool accessible by the public, is the kind of advancement and innovation we were talking about. The modern state-of-the-art hospital under construction at Goodwill is precisely the type of project to which we made reference. In other words, ladies and gentlemen, the pace might have been slowed by the occurrence of several events beyond our control. But rest assured that the commitment to modernizing and developing this nation of ours remains steadfast. I started this presentation by thanking the public officers who ran with the idea of helping young mothers as part of the gradual introduction of a national health insurance plan for Dominica. We set ourselves early 2017 for commencement, and all concerned pooled their weight towards making it happen. This is the type of synergy that is required to optimize output in the public service and minimize the level of apathy and cynicism that has impacted some members of the public who believe that the wheels of government turn too slowly. We all speak loudly about our disappointments and dissatisfactions from time to time. But on this occasion, I think we need to ask the public officers involved to take the salute for the timely delivery of this program. This is the end product of true team spirit and team workmanship. It is why I have reason just last week to remind listeners of the fact that I too was a public officer. I know and understand the nuances associated with working in the government service, and that generally it is more a labor of love than labor for reward. We have a cadre and a caliber of public officers in Dominica, of which we can be proud. The dedication and hard work that fueled the coming into being of this project is in just a few months must be replicated across the service if we are to achieve the goals we have set ourselves as a nation by 2020. I am aware that there will be situations and circumstances where the administrative and implementation arms of government will find themselves at differing ends of a discussion. But never are we to forget that the service to country and our fellow men is the ultimate goal and indeed obligation of all. The resources of government, need I remind you, are limited. Therefore, if we're to achieve our goal to creating a fair and just society, we must ensure that the interests of all are taken into consideration and that needs are at all times placed ahead of wants. In this regard, I am looking forward to the soon-to-be convened forum at which we sit as stakeholders in national development and become sensitized to and appreciative of the realities of funding the ambitious forward thrust in development that we have set ourselves as a nation. Building back better must not only be a catchphrase or popular slogan. It must be a creed. Building back better will require sacrifice and enormous effort. It must involve the inclusion of traditionally marginalized sections of our community. That is why it is important, I believe, for all to become familiar with and understand the size of the national cake that is to be shared among 70,000 inhabitants. We have as a nation to acknowledge who needs help right away and who can hold strain a little longer. What each person is doing is important. The plight of each individual must be of interest and concern to us all. Therefore, it is imperative that programs such as the National Health Insurance Pilot Initiative, which is being launched here today, be accommodated in the overall scheme of things. Some persons may believe that their interest or their charge is of greater importance or urgency than others' plight. But that is where common sense and good judgment comes in. That is where government has to reflect on all contending views and ideas and do right by all. I look forward to a very open and candid discussion on April 24th on the path forward for Dominica. I approach the discussion with a very open mind and with no preconceived ideas. What I would say, nonetheless, is that I am committed to ensuring that the social gains we have made as a people over the years are not eroded in the quest by some to score egotistical victories. What is the point, I ask of you personally, doing better if your pregnant sister is unable to access quality and affordable health care? What is the redeeming factor in your banking an extra $50 a month, but your little niece or nephew is unable to see the medical specialist he or she needs to diagnose and treat a life-threatening ailment? And we just saw this very touching testimony of a 3-month-old baby. Had it not been for the National Health Insurance Scheme and the compassionate nature of this government, what would happen to this little baby? This could have been my son, it could have been your daughter, it could have been your niece, it could have been your grandchild. This is what Dominicans signed on to 38 years ago when we fought for national political independence. Singing the national anthem and reciting the pledge is one thing, but stepping up to the plate and assuming national responsibility is what is required, particularly in post-Erica Dominica. So I love beauty, I love splendor is fine, but what about your own personal and national responsibility? The national conversation we need to have is how do we allocate and distribute resources to touch and impact the lives of all? Every Dominican is deserving of and entitled to a share of the national cake. And that is what should and must influence our thoughts, actions, and utterances going forward in this country. So I'm delighted this morning to officiate at the launch of this NHI pilot program. Previous speakers have outlined the structure, scope, and operation of the program. I want to say, as Prime Minister and Minister of Finance, that I am committed to the functioning and longevity of this initiative. I believe that generations to come will thank us for the sacrifice each of us is making to facilitate the coming on stream of this very worthy venture. The commencement of this program is possible today because as a government, we had to defer another venture that could easily have utilized the funding earmarked for this program. There will always be desire, but we have as a nation to balance this with fairness and reason. The potential beneficiaries of this initiative are deserving of the ease and opportunity that this measure will bring, and I am happy that it can be made available to them in the year 2017. I commend all the public officers and the officers of the DSS, the Cabinet of Ministers, particularly Dr. Darrow, the Minister for Health, our friends in power, our friends from the University of the West Indies, and all those who worked diligently over the past few months to make the timely startup of this program a reality. I am happy for the beneficiaries of this initiative, and I wish to appeal to you to cherish the opportunities that it provides, and please do not abuse it. Just as it is intended to help you, it is also designed to be there in future times for your children and for their children. Therefore, let us all be responsible and mature in our conduct with regards to this program, so that, though costly, it will prove a tremendous help to succeeding generations of mothers and children, whom, after all, are vital to our continued existence as a nation and civilization. Congratulations once again to all concerned, and I wish you Godspeed in the implementation of this most timely initiative. For me, I am particularly pleased about this initiative being launched today, because in my interaction with scores of people across the country, this is access to healthcare and access to affordable healthcare is a major challenge confronting families. And we must never look at life from our perspective, because we may have access to health insurance, we have access to resources, but life was never intended for us to look at ourselves. It was always intended for us to be our neighbor's keeper. The question is, are we prepared to be our neighbor's keeper? We're in the Easter period when a perfect being was crucified. Luckily, he was able to be resurrected and to be with us here today. That is the good Lord. So let us as Christians use this period to reflect on our own personal responsibility to our nation, our own personal responsibilities to our families, and to the less fortunate among us. And let us, out of the Easter period, our walk to the cross and to be at the feet of Christ, and to ask the good Lord to guide us as we build a more prosperous and just society. And because at the end of the day, we all have to answer to the Almighty when the trumpets are sound. What have we done for the least among us? God bless you.